So let me ask you an honest question. Do you wake up in the morning, brush your teeth, but when you spit, there is blood in there and you just ignore it saying that it's normal or you're brushing too hard? Then let me tell you that's absolutely wrong. 99% of the time, bleeding gums is not because of hard brushing. It is because of the bad bacteria which is inside your mouth that is causing gum irritation, gum swelling and bleeding gums. So in this video, we will be discussing simple practical steps that you can take to avoid and stop bleeding gums. Hi, I'm Dr. Sneha. I'm a periodontist, which is gum and bone specialization, and I'm the clinical head of Tooth Medics Dental Clinic. Before we go into the actual steps to follow to stop bleeding gums, let's just understand why does the bleeding actually happen. I'll give you a small example. Have you seen a pebble or a rock that is submerged in a pond or a lake? When you touch it, it's quite slimy. This layer is called as the biofilm. Our teeth are also submerged in the saliva and it forms a biofilm similar to that. Now, if we brush 2 times a day and nicely remove this biofilm, then there is no problem. Our teeth are healthy, our gums are healthy. But if you are unable to remove this biofilm, then it forms a complex structure called as plaque, which is filled with bacteria. Now this bacteria which is there inside the plaque on the tooth surface starts going below the gum line and starts irritating the gum, and this in turn causes gum redness, gum swelling and bleeding gums. Now there are other reasons also that your gum can bleed, but trust me, 99% of the time gum will bleed because of the presence of the increase in the quantity of these bacteria. So all the steps that we'll be discussing further are targeted to decrease the quantity of bacteria and thereby making the gums more healthier. The step number 1 is don't stop or avoid brushing. Most of us, when we see this blood, we become scared. We either stop brushing or start brushing very slowly, and thereby we are just promoting more plaque formation and more bacteria inside our mouth. So what you have to do instead is to brush 2 times a day with short circular motions. Make sure all the surfaces of your teeth are covered properly. Step number 2 is to change your brush. So switch to a ultra soft toothbrush. Here we want our brush to clean the teeth surface, but we do not want the brush to irritate the gums which are already swollen and damaged. So ultra soft brush will be gentle on your gums and will not irritate it further. Number 3 is to use a gum protective toothpaste. Now in the market we have certain special toothpastes which contain active ingredients like zinc phosphate, zinc citrate. So these are all active ingredients which help to decrease the bacterial count and thereby help your gums heal. Number 4 is flossing. So till now we have changed our toothpaste to a gum protective toothpaste. We have also changed our brush to a ultra soft brush. We have also started brushing twice a day. So all this will decrease the bacteria on the surface of the teeth, also make the gum healthier. But what about the deposits which are present between the teeth? Now these deposits can only be removed with the help of flossing. You can definitely use a thread floss which is available very easily in your grocery shop or in your nearby medical shop. So this thread floss goes between your teeth and helps remove the deposits from there. But definitely a better option for you would be a water flosser. Though it is slightly expensive as compared to a thread floss, but believe me, it is an investment which is worth. This water flosser will release water with a force which will then penetrate the space between the teeth and then clean that area. Number 5 is to rinse as soon as you eat your food. When we rinse, there is a certain force with which the water swirls inside our mouth, and this force is enough to remove the biofilm. Remember, we spoke about the biofilm earlier in this video. The force of the water is enough to remove the biofilm. When the biofilm is removed, it will then not form plaque and will not cause any kind of gum problem. Now, definitely bleeding gum is a disease. It is a warning sign that your body is giving you that there is something wrong. So you definitely should visit your nearby dentist and get it checked. If the bleeding is very mild and it has just started, then a quick round of cleaning is all you require to remove the deposits and thereby make your gums healthier. But on the other hand, if you're already a diabetic patient, you have habits such as smoking or tobacco consumption, or you already have some predisposed gum problems, tooth problems, then maybe you require a deep cleaning, which again the dentist will be able to tell you after a quick round of checkup. So I hope this video was helpful and useful, and do share this video with your friends and family, and do subscribe to the channel. I'm Dr. Sneha signing off.